Welcome to episode 12 of Wearable on Air. My name is Hilary Topper, and I'm president and CEO of HJMT Public Relations, and I'm also the host of Wearable on Air. What we do at Wearable on Air is we help promote wearable products and services, and today's show I'm really excited about. I'm interviewing Jen Ohlson, who's the founder and president of Interactive Health Technologies. We have a serious crisis in this country with childhood obesity. Jen's company developed a heart rate monitor that will monitor children K through 12 during physical ed classes. And what this is going to do is this is going to, number one, monitor our children so that if there is a heart issue, we'll know about it. And also, it'll help us find out how their activity level is progressing. But before I get on with my first question for Jen, I want to give her kudos for running 36 marathons and 3 Ironman triathlons. That is incredible. I just started doing triathlons, so I am totally impressed. So, welcome to the show, Jen, and tell me a little bit about your product.
So we started the company in 2012, and the goal and the purpose was to empower individuals, specifically students, to learn how to self-manage their health and their well-being through accountability, through assessment, and through education. And so with that purpose in mind, we decided physical education classes were the best way to reach students. Home is obviously the best place to build the foundation of health, but school is the most logical, and physical education classes were the place where we started. And we implemented the program in 2012. We're now in 35 states, have about 400,000 students a day wearing our technology in school, in PE classes, connected to themselves and to the entire stakeholders that surround them.
That's awesome. Do you have actually a sample that you could show us?
I do not. I'm at a conference. I'm at the state conference for Florida, where all the physical education teachers from across the state have come together for the next 3 days. And I left it at my exhibit booth where it was really loud. So I'm in another ballroom, and I unfortunately do not have but it's a basic chest strap that kids come in. They tap into a little reader the size of a credit card, and it uploads all of their personal information because every student is unique. So the fittest athletes or the least fit, their personal settings go into the heart rate monitor. They do their workout, and then as soon as they take the monitor off, it instantly goes to their phone, goes to their parents' phone, so their parents could be sitting at work, and they get the information right on their phone. So it's an instant feedback, but there's that deferred gratification of having to work for the activity that they're doing.
Yeah, so if you are not working as hard as you could be working, you're gonna see that right away. And I guess the physical ed teacher will say, come on, guys, you can do a little bit more than that.
Yeah, absolutely. So it's for the athletes that maybe are working too hard, because that certainly happens, as you mentioned, with the crisis we face with obesity. Every time you take, asthma, 25% of our kids, when they take an inhaler, raises their heart rate 20 to 30 beats per minute. But also for those athletes that may not be working hard enough. So it really does level the playing field, whether you run a 20-minute mile or an 8-minute mile. How do we know as teachers, as educators, using what the technology at the time was a stopwatch, the kid who ran the 20-minute mile gets an F, and the kid who ran the 8-minute mile gets an A. Well, now we've leveled the playing field. The heart rate monitor is objective data, and it's individual for each student. So now everybody's included. It's not just the athletes, and it takes physical education class and makes everybody the participant in it.
I also wonder, Jen, about after-school activities like Little League and, that type of thing. I mean, I remember a few years back there was a student in Merrick on Long Island who passed away during a Little League game, and he had a heart issue. Can you see this becoming mainstream for these types of sports and activities?
Absolutely. We were actually, we have one of our largest school districts here in Florida in Brevard County, And we went down and did training in August. And the night before, 2 football players at different schools, but in the same district, died of heart conditions because of the heat and exhaustion. But what if they had been wearing a heart rate monitor? If we had been able to maybe track them over, a few weeks, or that day said, hey, it's time to take a rest. So you look at the cost of what it's costing, not only those individuals and those families, but the cost to the states, the cost to the taxpayers. If we don't get a curb on self-managing healthcare, we all know what the consequences are. Our feeling is that if we can get to kids early enough, and we can get individuals on the path started early, that they'll build those healthy habits, that they'll become the health promoters in their lives, and then in turn, hopefully, they'll become the health promoters in their parents' lives as well.
What was your inspiration for developing this product?
Well, I think, just the crisis that we all face. I was a former sportscaster, and as you know, as a, media person, you're always curious, and you're always asking questions. And so I saw a huge need with physical education classes being cut, which I thought was like the front line of defense for our healthcare problems. I knew that healthier kids were smarter kids, but we didn't have the data. I thought school, again, was the most logical place. So I kind of put all the pieces together. I also wanted to reach individuals, especially kids, where they live their lives, and where, you and I in our generation, sports was our lives. We were outside all the time. Well, today, this is kids' lives. This is where they speak. This is their language. So I was like, how do we connect the language that kids speak to health? And how do we do it in a way where they don't have to do after-school programs, and they don't have to work out on the weekend, but they do have to go to school, and they do have to go to physical education. So you have a captured audience speaking the language that makes sense to them, and then all the pieces came together. Once that happened, then we said, let's connect all the dots. Let's connect health to academics and attendance, and really show the healthier kids are, the better they do in all areas of their life.
I have one more question for you. I guess this is a little controversial in terms of privacy. Do you ever find that people say, well, I'm not going to wear one because that's, against my privacy?
Yeah, I mean, absolutely. It's a program that you opt into, so we work on it's a very organic process. We work with each individual school district. It's not, we don't go to the state level and say this is mandated for everyone. We go to school districts that want to implement our program. Once we get the buy-in from the school and the teachers, then it's a proactive approach with parents, and parents can say, hey, not interested, and that's perfect. We can put as little as just a last name in with no other information. So the data can be as aggregate and as general, or as individual, as a school or that community wants. So it's our highest priority with privacy. It was certainly one of the number one things. Simplicity of the system, and then privacy were number 1 and 2 on when we were developing the program.
Let me ask you, where exactly are these? Where do you have, where are they located in the schools right now? Are they mostly in Florida, or are they across the country at this point?
Yeah, they're across the country. We've built some major partnerships with the D.C. public schools, Washington, D.C. They, looked at our program for maybe a couple schools, but because we have the ability to not just capture heart rate, we can then take that and say, okay, how does this affect academics and attendance? So what started off as maybe a couple schools interested turned into a district-wide in Washington, D.C. with a 3-year plan. They actually won't buy another product for physical fitness if it doesn't complement our system, because everything else is the movement. We measure the movement. So, to have that assessment is so critical. We're based in Austin, Texas, so Texas our stronghold in from our birth in that state, but everywhere from California to Florida to Washington, D.C. to Wisconsin, 35 states across the country have adopted, in individual schools within those states. And we're young, we're just 2.5 years old, so we're new kids on the block, but we're leading an assessment for wearable technology right now.
I love it. I think this is awesome. I just want to ask you, if people want to have your heart rate monitor in their schools, how do they go about doing that?
Sure. The easiest thing to do is to just visit our website. It's ihtusa.com. There's lots of videos. They can send us an email straight through there, learn a little bit more about what the product's capabilities are, and then it's custom packages. We don't say, hey, you have to have 24 monitors. You literally have to have just as many heart rate monitors as your largest PE class. So if you have 20 kids, you just need 20 monitors, and then those 20 monitors will go period 1, 2, 3, 4, 5. So I'd wear it period 1, Hilary would wear monitor number 11 period 2, somebody else. So it's really economical that you don't need to have massive numbers, but certainly they can reach out to us. We would love to put together a quote for 5 to 50 to 100 to meet their budget and work within their budget.
Well, I wish you a lot of luck because I think this is fantastic, and I really hope that a lot of you guys out there who are listening to this program call up your district and check out their website. That was Jen Ohlson, and she's from Interactive Health Technologies. And this is Hilary Topper from HJMT signing out. Thank you so much for listening, and check back next week for our next episode of Wearable on Air.